Hey, what is up, guys? Welcome back to Confessions of a Doctorholic. I'm your host, Dr. Slayman, and today we are talking about a very humbling, very unglamorous part of my journey, the post-op life, and the surgery itself. Now, in the last episode, we talked about the whole falling like Icarus saga, the rock wall, the fracture, the ED visit, but what they don't tell you in medical school is that recovery from surgery, that's where the real trauma begins. Specifically, trying to pee after surgery. Let's get into it. So, my operation was the first thing in the morning. So, as a surgery resident, there are a few traumas that you carry with you for the rest of your life. Examples include skin flakes, when you take someone's sock off during vascular surgery. Another example is the hidden treasures that you find in someone's belly button. And the final one, and probably the most common, is the gorillas that you find around. And the uneven shaving and bikini waxes that they get on the OR table. I knew they were just operating on my leg, but my pre-surgery prep included shaving everywhere, giving myself my bikini wax, and also cleaning my bladder. Oh, and I for sure showered. They told me not to, but I was not going to let anyone deal with that. We've already done blood tests pre-upping for the OR a couple of days before the actual surgery. I just had to rock up. So I'm there on time. A mate drops me off and they do the pregnancy test. It's negative. I'm not surprised about that. My senior on the rotation, also my crush during that period of time, brought me these large men's scrubs, which I requested. I just needed something that would go around the cast that they said would be abnormally big. And I had nothing that was stretchy and no shorts at home. And it's like the middle of winter outside. And then the resident rocks up with the anesthesiologist. They explain to me that they're going to do the nerve block and then they're going to roll me back. I'm like, cool. I remember seeing the ultrasound. I remember being interested in it. And I remember feeling the pokes. It was quite painful. Or like kind of groggy. They must have given me some Versed. I'm rolling back to the OR. I see the OR lights. I'm a little bit cold. They tell me to hop over. So I'm like hopping over to the bed. I wonder if they asked me, what are you going to do today? Because we always do that during surgery. Don't remember that in that particular moment. But either way, I'm out. And then I remember waking up and being in the post-op bed. Two of my mates, R&R, were already there. They mentioned later that they've had full-on conversations with me. I do not remember. What I remember in that moment is someone bringing me food. And then the nurse saying we took the Foley catheter out and me really needing to pee. I'm still groggy as hell. I had a pretty big surgery, I would say. It was about 6 hours long from what I was told. They fixed my fractured tibia and medial malleolus. I was literally like a bionic bunny. I'm wrapped. I'm doped up. I'm in recovery bed. And all I can think about is I really need to pee, like urgently, like now. So the nurse comes in and she's just asking me how I'm doing, if everything's okay. And I tell her this and she's like, cool. Would you like to try to use a bedpan? Now listen, I've watched hundreds of patients using bedpans. I've handed them out. I haven't cleaned them up. That's lucky for me. I've encouraged people to use them with my most compassionate bedside voice. But in that moment, that compassion was nowhere to be found. I look at her and I'm like, absolutely not. I am not peeing in a bed. She tries again. Okay, how about the commode chair? And I'm thinking about my mates that are behind the curtain. Still no. That chair is literally one of my nightmares. It's like an adult potty with wheels. And also, I wasn't going to go down like that. I mean, I'm okay with patients using them, to each their own, but that wasn't going to be my story. Eventually, the nurse gives up trying to negotiate and goes like, okay, I'm just going to wheel you to the loo. So keep in mind, I've got a giant cast on my leg. My foot is elevated and I'm still loopy from the nerve block. And I just have a gown on, so I'm naked from behind. But we made it work. They wheel me into the loo like I'm some regal patient queen. It was a little dramatic, I'm not gonna lie. Imagine being in this clunky wheelchair, hair's a mess, hospital gown flapping, IV lines dangling, all because I refused to use a bedpan. That was the hill I chose to die on. But then I finally sat down on that toilet and I managed to pee. And it was pure bliss. I nearly cried. That was like the best feeling ever. Would recommend. So the nurses had their shift change. The sign out that I had was for risk and a difficult patient. So evening nurse comes in and she's like, "You're too young to be a full risk. And I heard you were difficult." So I look at her and I'm like, "I just don't want to pee in my bed." She was like, "I got you. It's all right." So I must have called them about 1,000,000 times overnight. I feel like she probably regretted her choice. Stayed in the hospital overnight. It was a bit daunting. I felt a little bit lonely, not gonna lie. I had heaps of messages from my friends, but understandably, people had shifts the following day. And then the following day came, I had physical therapy see me and help me do basic transfers, getting up and down stairs, moving around with crutches, moving around with the wheelchair. And then I was discharged with some meds at bedside. That was the first moment I realized how something so basic, like being able to go to the loo by yourself, feels like a privilege after surgery. And let me tell you, I gained a whole new level of empathy for my patients. All those times I'd hand someone a bedpan and say, just try, without realizing how uncomfortable, unnatural, or just plain weird it is. I get it now. I was also extremely lucky to have a great care team and even better friends who visited me, fed me, and didn't make too much fun of me when I told them the pee saga. It's these weird human moments that no one prepares you for, but in some strange way, they're the ones that stick with you the most. So, confession. Surgery recovery? Not glamorous, but it's real. And sometimes being a doctor-patient is the best reminder that our patients are going through a lot. Even when it's just about something as simple as using a loo. Now I want to hear from you guys. Have you ever had a post-op moment that was completely embarrassing or surprisingly hard? Let me know on the gram or threads. You can find me on @Hafsa Slayman.